coronavirus. I would now play the video of the speech of Fatma Farhan from Canada.
Hello everyone, my name is Fatma Farhan from Calgary, Canada, and my topic that I'll be speaking on today is health for all. First things first, we must acknowledge that nothing is more important for us as an individual or as a collective than our health. Everyone is deserving of it, and everyone must have access to it. But unfortunately, in our fast-paced world, while the spread of diseases is faster than ever, the cures aren't as easy to find for everybody. Therefore, we will begin by reinstating the fact that health is very important, whether it be physical or mental. One of the things that come up when discussing health for all is the right to have access to food and water. There may be some among us that argue that no one out there is truly deprived of water. But let us take a closer look at the issue. When we talk about water deprivation, we are including those of us that have to walk miles to get access to water. And a lot of the time, that is done under the scorching heat of the sun. Not to mention, more often than not, the water that they do have is not clean. It's contaminated with multiple kinds of germs and bacteria. Adding on, we are talking about approximately 2 billion people out of our world population of 8 billion that have to face this problem on a daily. When we are discussing the problem of how unclean and contaminated water with respect to health for all, it is imperative that we acknowledge how unclean water or no access to water at all deteriorates our health. Moving on to the next issue that presents itself when the topic of health for all is being discussed, we must now talk about the idea of universal healthcare and how in many places in the world it is near impossible to get medical care and treatment without sufficient funds in some parts of the world. However, in some places, free public healthcare is provided, such as Canada and the United Kingdom. Health is the last thing that should be capitalized, and no matter how fast our society is globalizing, we cannot allow for something as basic as healthcare and health in general to be put on market for display. According to the World Health Organization, at least half of the world's population, which is about 4 billion people, cannot access sufficient health funds. This comes up as an issue in countries like Nigeria and Egypt, where without having the funds for it, citizens are not able to get into the doctor's office to even discuss what's going on with them. Let's also not forget that the nature of healthcare in a lot of such societies. Some of these nations are known for doctors that don't even have the slightest clue of what they're doing, but dish out diagnoses like it's nothing. These diagnoses can sometimes cost patients their life. So what adds up is that healthcare services are another thing that need to be given special attention to. And we cannot even begin to talk about health and healthy living for all without having down the basics of healthcare. In conclusion, the acknowledgement that health is important and that everyone deserving of good healthcare and healthcare services is only the beginning. Adding on, there are a lot of talks on the topic as it is, but not much action. How can we possibly hope to grow as a society if we cannot even provide our people in humanity with the essentials of healthcare? But rather, we can only talk about what a shame it is that more than half of them don't have access to the most basic rights. The answer is simple. We cannot. We must take a stand for all of those deprived of the most basic human rights and advocate health for all.
Now I would like to invite Aayzah from Hamdard Public School to deliver her speech.
Health is a state of complete harmony of the body, mind, and spirit. When one is free from physical disabilities and mental distractions, the gates of the soul open. B.K.S. Langer. Just like this, we all have heard many quotes about health. Just like a very common one, health is wealth. It is a very common saying that I'm sure all of us have heard. But the question arises, whether you have tried to ponder upon it or not. Honorable judges and fellow delegates, a very good morning to all of you. I am Aayzah from the Mama Parsi Girls Secondary School. I am the Mama Cadets or the Health Secretary working as a member of the Students' Council over there. And today, I am here to shed some light on the topic health for all on this auspicious occasion. In human life, health is the most essential and vital thing that we all need to survive. Health is the real wealth, as one can surely survive without excess money, but cannot survive without good health. No one can feel completely happy and content with an ailing health. To be fit is an essential required in for everyone and in all walks of life, as one can merely accomplish a particular task if his health is not fine or if he or she is not physically or mentally fit enough to live through it. To be fit is an essential surely required for everyone, and hence every informed individual gives health the highest priority, hence acquires good habits in life too. If an individual is wealthy but his health is ailing, then he has no use for his wealth, of course. Similarly, health is the most important aspects of our life. This day is dedicated to spreading knowledge of different illnesses, care, preventive measures, good health, exercise, and other criteria related to health. Health is very critical in today's rising world. We need to make this day a moment of our lives, a moment where we promise ourselves to stay fit and fine for the rest of our lives. At least we can try our best to. Generally, a healthy lifestyle is the highest blessing that we should not take for granted. But unfortunately, we do neglect the importance of healthcare in our emphasis on work, eating, sleeping, or in our daily routine. We also ignore it to the degree that we only remember it when health worsens or illness occurs. And I'm pretty sure all of us can relate to this. Hence, it is necessary to make individuals aware that health is wealth. We need to recognize that well-being is an important component of our lives. Keeping yourself fit and safe is important with so many diseases prevailing in the world. In order to live a robust life, only few habits need to be adopted. The only few habits also need to be a part of our quotidian existence, which really includes physical activity. Everyone should at least do 30 minutes of physical activity per day to stay healthy. Of course, along with physical activity, an intake of balanced diet is also an essential. Taking carbohydrates, proteins, vitamins, fats, minerals, and water according to suggested guidelines is very important for a healthy life. Intake of a balanced diet is one thing. Secondly, managing your sleep schedule is something that we all really neglect. Even people who are very health conscious, they sometimes do not care enough about their sleep schedule. This is one of the primary and key factors which determines our health. Hence, this should be kept in view too. Okay, so the easiest way to improve your health is to increase your water consumption on a daily basis and we all should avoid soda drinks or drinks with artificial sugar content, as they are really harmful for our health. Finally, we are all aware that our health is the most important wealth that we have. Health is the only wealth we are born with. And you know what? We can also die if we don't have good health, leaving all of the tasks and mere worldly activities in this world only. Let this be the moment from where onwards we all will adopt a healthy lifestyle as our first priority. Thank you.
Thank you, Abhiha. The preamble of WHO clearly states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being, without distinction of race, religion, political belief, economic or social condition. I would like to call Aayzah Khan from Hamdard Public School, Lahore, to deliver her speech.
We live in a world breathing in urgency, breathing with difficulty, breaking under necessity. We are a society consumed by technology, impacted in proximity, and jogged by inactivity. Here, everybody talks about health, but does very little about anybody else. People get focused on their own health and they think that as long as I'm sorted out, life is okay. But that's not okay. Health must be for all. A very gracious welcome to all the lovely people present here and watching me live. Myself, Anna Marzia from Hamdard Public School, Model Town, would like to thank you to give me such a great opportunity to say something on the topic Health for All. The slogan Health for All was given by the World Health Organization, WHO, in the year 1977. It aims that health is to be brought within the reach of everyone in a given country. A state of health that enables a person to lead a socially and economically productive life. Madam President, the 7th of April each year is celebrated as the World Health Day, and 75th anniversary is being observed this year. Instead of remarkable progress in the field of science, technology, and medicine, there is, however, a wide gulf between the health haves and the health have-nots. People living in Asia and Africa tend to have less access to health services than those in the better off countries. For instance, every year around 10 million people in the poorer countries die of illness, which includes malaria, HIV, tuberculosis, and diarrhea that can be cheaply prevented or managed. Madam President, average life expectancy fluctuates between over 70 in some countries to barely 50 in others. In most developing countries, from nearly 100 to more than 200 out of 1,000 infants born alive die during their first year. Women in the most poor countries have a 200 times greater risk of dying during pregnancy and delivery than the women in rich countries. Therefore, the theme of UHC in 2020 was Health for All, protect everyone to end this crisis and build a safer and healthier future. We must invest now in a health system that protects us all now. So, all people have a right to quality health care without any kind of fear of financial hardships or discriminations. Leaders can and must ensure that quality healthcare services reach everyone based on need, not on their ability to pay. The world needs people like Abdul Sattar Idi, Balkis Idi, Lutfa, and Nancy Mandela. Surely, we all must recognize that health is not everything, but there is nothing without health. In the interest of all human race, there must be a health for all and all for health, because wherever the art of medicine is loved, there is also a love of humanity. Thank you.
Thank you. The World Health Organization implies the health for all as the attainment of all people as the highest possible level of health. Everyone, everywhere should have a right access to healthcare services despite their economical conditions. I would like to invite Muhammad Ali Abdullah from Hamdard Public School, Islamabad, to share his views.
Respectable guests and my dear friends, Assalamu alaikum. Human health refers to well-being of an individual encompassing physical, mental, and social aspect. It is a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity, according to World Health Organization. Overall, human health is a complex and multifaceted concept that encompasses many different factors, including physical, mental, and social factors, as well as access to healthcare and other resources necessary to maintain good health. The World Health Organization has established several policies aimed at achieving the goal of health for all. The Health for All policy framework is based on principle that all individuals, regardless of their social or economic status, have the right to access high-quality healthcare services. Overall, WHO policies for Health for All are focused on ensuring that all individuals have access to high-quality healthcare service and the health is viewed as fundamental human right. These policies are intended to promote equity, improve health outcome, and reduce health disparities between different populations. World Health Organization has been actively involved in Pakistan for several decades, working closely with government and partners to improve public health and healthcare services. WHO had played a crucial role in the control of eradication of polio in Pakistan, which is one of 3 countries where the disease is still endemic. The organization has also been involved in control of other infectious diseases such as TB, malaria, and hepatitis. WHO has supported the government of Pakistan in strengthening the country's health system through various initiatives. This includes support for development of health policies, human resources development, and provision of technical assistance and guidance. WHO has actively involved in emergency effort in Pakistan, particularly in response to natural disasters such as floods, earthquakes, and droughts. WHO has been involved in health promotion activities in Pakistan, particularly in the areas of maternal and child health. Overall, WHO contribution in Pakistan have been significant, improving public health and healthcare services in the country. Thank you.